Prostate cancer is a cancer that exists within the prostate gland. The prostate gland is part of the male reproduction system. It is located below the urine bladder and assists in male reproduction. As a man gets older, the prostate gland undergoes two forms of changes: enlargement, which is non-cancerous, as well as a possibility of a cancer change. Fortunately, cancer change is less common than non-cancerous change. However, in the last 10 years, prostate cancer has been on the rise. It is the fastest increasing cancer in men in Singapore, and it is currently the third commonest cancer in men. In early prostate cancer, there are actually no signs or symptoms, which means a person may be suffering from early prostate cancer without him even knowing. In more advanced prostate cancer, then a man may suffer from urinary disturbance such as difficulty in passing urine, frequent urination in both day and night, or sensation of difficulty in completing his urine passage. In more advanced cancer, where the cancer has spread beyond the prostate gland, the person may then feel symptoms from the bone if the cancer has spread on to the bone, such as bone pain. Therefore, our emphasis is to encourage our patients to detect prostate cancer in the early stage, where it is still very highly treatable, but unfortunately when it is not showing any signs or symptoms. We detect early prostate cancer by doing a blood test called PSA. It stands for Prostate Specific Antigen. It's a very simple blood test that can be done as part of any family doctor consultation or part of a health screening process. From the blood test, we would then know whether the person has higher, lower, or average risk of prostate cancer. The person will also be examined through a rectal examination, where a finger will be placed through the rectum to feel for the prostate gland to look for a growth or a lump within the prostate gland. If a person has a lump or an abnormal PSA blood test reading, he will then undergo a prostate ultrasound as well as a biopsy of the prostate. A biopsy of the prostate involves putting a very fine needle to take a few samples of meat from the prostate, for which then the laboratory will do further analysis to confirm whether the suspicion is cancerous or not cancerous. Prostate cancer, fortunately, is a slow-growing cancer. Therefore, the process of screening for this cancer need not be done too frequently. It is safe in a person with no symptoms to do a PSA blood test as well as a rectal examination of the prostate only once a year during their routine health checkup. Early prostate cancer is highly treatable and cure rate is extremely high. We are talking about above 90% cure rate. Early cancer is within the prostate. It has not spread out of the prostate and has not gone into any lymph nodes or bones. In this case, the prostate can be totally removed by surgery, and usually we do a robotic assisted surgery that is done with a little or few holes in the abdomen. The recovery from these surgeries has improved tremendously in the last couple of years, where most of our patients can actually be discharged from hospital after 3 to 4 days. An alternative to robotic surgery would be to do radiotherapy. Radiotherapy involves administering an external beam radiotherapy onto the prostate gland itself from the front of the body, and it is administered on a daily basis over a period of 7 consecutive weeks. The success rate of both robotic surgery as well as radiotherapy is extremely high. For early prostate cancer within stage 1 or stage 2, we are talking about more than 80 to 90% survival after 10 to 15 years.